Mental health problems are common. Many people are not well informed about how to recognise mental health problems, how to respond to the person, and what supports are available. Professional help is not always immediately available, while many people with mental health problems delay seeking help or do not seek help at all. Kerry Mental Health Association has commenced the rollout of its programme of free and affordable mental health first aid training courses in County Kerry. We now have 6 instructors who have received the necessary training required to deliver courses to adults involved in community and non-for-profit organisations in the county.
Our role really is to help people who are developing a mental health problem, a worsening of an existing mental health problem, or experiencing a mental health crisis. And I suppose, making sure that we signpost them to get the appropriate help and services that they require.
The mental health first aid training has been shown to improve attitudes towards people with mental health difficulties, reduce stigma, and improve knowledge. It improves people's confidence in providing help and the likelihood to advise people to seek professional help.
I suppose a lot of my core values would be around voluntary work. I've done voluntary work all my life, and I think that mental health is a really important area that we need to reduce the stigma and increase the knowledge, and that's something that mental health first aid training provides.
I suppose one of the things why the mental health first aid for me is such a really beneficial is because obviously as a lecturer I'm working with a lot of students on a daily basis, and it was one of those things when I first started off as a lecturer that I felt very vulnerable was to the lack of structure in how to deal with, say, kids or students, for example, with issues that range from everything from, be it anxiety, be it stress, etc., etc.
Kerry Mental Health Association has committed considerable time and energy to secure the funding to cover the cost of training 6 Kerry-based volunteer mental health first aid instructors.
I've been involved with the Kerry Mental Health Association for a number of years, and our manager came up with this initiative that we should get involved in this programme, and I thought it was a very good idea because of the challenges facing our association are different now than 50 years ago when it was started. I have a background as a technical instructor, so I volunteered to train as a trainer, and I thought it was useful, worthwhile, good program that I'm happy to give of my time of and get satisfaction from it.
It's very, very important, no more than normal, everyday first aid. I think that mental health first aid is equally as important, and the more people that are comfortable and have confidence and openness in talking about mental health issues, and the course gives people the toolkit to enable them to do that.
The Mental Health First Aid course is a 12-hour course, 4 modules, each 3 hours, that teaches people how to assist someone who is developing a mental health problem or in a mental health crisis. Participants will learn the signs and symptoms of mental health problems and what sort of help has been shown by research to be effective. They will learn a framework for communication, how to offer and provide initial help, and how to guide a person towards appropriate treatments and other supportive help.
For me as a lecturer, it's given me the tools and in life, outside of, say, obviously working, to be able to deal with a lot of different things in a better context and a better structure, So I would say to you that it's one of the most positive and one of the most amazing things I've done in my life so far.
Our instructors provide a comfortable learning environment and are trained to support your participation and learning.
I would encourage people to attend mental health first aid courses because it's a well-developed course, right? It started in Australia. The mental health issues that we discuss are very common and prevalent in our society. So it will provide them with very important, useful training to help people in their community.
So no more than if you had a defibrillator or a medical bag, it gives you the tools that you need, but more in your head, and it takes away the myths, it takes away the stigma, and it helps you to engage with people who are experiencing mental health issues.